Good afternoon and welcome to our Binational Health Week Community Forum. Today will be the last one that we have for the month of October. Thank you all for joining us during this month to find out about new resources or existing resources that maybe some of us did not know about. Today, I'm happy to welcome Lydia Santillan. Lydia, welcome.
Thank
And
you.
yeah, and Lydia is our field operations specialist for California Phones. She has been working there for over 13 years, providing resources and services to our families and our communities. And we are happy to hear about what she has to share with us today to let us know what are the resources that her agency provides. Welcome, Lydia.
Thank you, Corina. Yes, I'm super excited about the information that we have available. Hopefully, some of our viewers will be able to either benefit from it, or maybe they know someone they could benefit from these services.
Absolutely. Thank you so much. And we have Gloria behind the scenes helping us with the presentation. So she'll be putting that up for us. And then at the end, just reminding the audience while we wait for that is we will have an opportunity for questions and answers. So Lydia will be here and I will also be here to help support with any questions that you might have regarding her presentation today or any resources that she might have. So make sure to take note, make sure to put in your questions in the comments and I will make sure to read through them. So Lydia, take it away.
Yes, well, good afternoon once again. My name is Lydia Santillan, and I'm a field operations specialist with the California Telephone Access Program, CTAP, also known as California Phones. The California Telephone Access Program is the California state mandated program of the California Public Utility Commissions. CTAP has been around for over 40 years, providing telecommunication devices for the deaf and severely hearing impaired consumers. In 1983, it was mandated in addition of the relay system, the California Relay Service, to connect TTY users with other telephone users. By 1985, they realized that there was a lot of other consumers not being able to use the telephone, not only due to hearing loss, but to vision, mobility, speech, or memory. So they added those certifications to the program. Now, the California Telephone Access Program is funded by a small surcharge that appears in the phone bills as California Relay Service Communication Device Fund. So whether you have landline or cell phone, you are contributing to this program and you have since day one when you sign up for the service. Next slide, please. Applying is simple, easy, and fast. This is one of the programs that you don't have income requirements or age restriction, meaning that it's available either for a 6-year-old or for a 70-year-old. Next slide, please. CTAP's main goal is to provide specialized telephone equipment and service for Californians who have difficulties hearing, seeing, moving, speaking, learning, or remembering. What's nice about this, if you notice, it doesn't specify a number, meaning that someone doesn't have to be legally blind or deaf in order to qualify. Something as small as reading glasses, contact lenses, as long as they're prescribed, someone would qualify for this program, people with arthritis, diabetes. So I just wanted to make sure that was kind of clear out there. Next slide, please. Specialized devices for people with difficulties hearing. So you're going to be seeing repetitive stuff as I'm going through some of the equipment and how they're going to help someone with their needs. The reason for that is because the telephones are designed to help with multiple needs. So right here on the screen, we have equipment for people with difficulties hearing. Some of the phones, or most of the phones, are going to amplify. Some of them are going to have captions, so whatever they can hear, they'll be able to read. They also have tone control for clarity. Some of them are compatible with hearing aids, speaker phones, flashing light for when the phone rings. Next slide, please. Specialized devices for people with complete or severe hearing loss. Once again, we see captions. We see the TTY, which is a teletypewriter for people that are deaf or have severe hearing loss or have a speech problem. They also have flashing lights when the phone rings, super loud ringers. They are compatible with T-coil or hearing aids. Next slide, please. Now, devices for people with difficulty seeing. We have extra large buttons. They also offer high contrast buttons, so color is going to make a big difference for people with vision problems. Talking keypads, speaker phones, and lighted keypads. Next slide, please. Devices for people with difficulties moving. We offer cordless phones, and aside from the cordless phones, these phones are gonna connect. They're portable phones, but they're also gonna be able to be long ways. They also offer amplification. They also have a speed dial. So for someone with severe mobility and hearing loss, this is going to be a great device. Now, devices for people with difficulty speaking, some of these phones are going to amplify the outgoing speech. They are also speaker phones, anti-stutter device, artificial larynx, the TTY for teletypewriters to communicate better. Next slide, please. We also have devices for people with difficulties learning or remembering. These phones are going to offer speed dial, dial by picture, voice activated dialer. So it's a lot easier to look at a picture and press that picture and it makes the call than trying to remember a whole number. Next slide. So for folks that only have cell phone service, CTAP offers mobile accessories to make communication easier on the mobile devices. These devices are going to amplify. They're going to allow you to be hand-free. They also offer speed dialing, and it could be connected either through a cord or through Bluetooth connection. Next slide, please. The California Relay Service facilitates telephone calls from a TTY to a non-TTY user simply by dialing 711 or the toll-free number for English or Spanish. The service is available 24 hours a day, 7 days a week, free for all users. And all that means is that there's an operator assisting with the call from someone that's typing the conversation, which is a TTY, to someone that has a regular landline. So it's just facilitating the call. Next slide, please. The California Speech-to-Speech Service enables people whose speech has difficulties for others to understand to communicate by telephone. Once again, they simply dial 711 for English or the toll-free number for the Spanish. The service is available 24 hours a day, 7 days a week, free for all users. Next slide. So what are the requirements for someone to get a free specialized telephone? They must live in California, so meaning it's a state program, have telephone service, whether it's a landline or a cell phone, and it doesn't matter who's paying the bill. So as long as they have phone service, they live in California, and if they have difficulties either hearing, seeing, moving, speaking, learning, or remembering, that's what would qualify them. Next slide. Completing the application has 3 easy steps. The applicant enters the information on section 1. Number 2, a certifying agent checks one or more impairments on section 2, providing that one of the disabilities is within their scope of work. The applicant signs and returns the form to CTAP either by mail, email, fax, or in person. Next slide. Here we have a list of the authorized certifying agents. So it could be your primary doctor, it could be a physician assistant, a nurse practitioner, department of rehab, it could be the optometrist, audiologist, and so on. So what's really neat about this is that if you have a primary doctor, he could check off on any needs that you have. So meaning if you wear glasses, he could check off low vision. If you have mobility problems, he could check off mobility. And if you have hearing loss, then he could check off hearing loss. So he's the one that's able to check all the boxes that are in the application. Next slide, please. This is a map of the different service centers that we have throughout California. Some of them are only open part-time and some of them are open full-time. We do have one in Santa Clara County. So it's in San Jose. And I'm going to give the number at the end for anyone that is interested in visiting that center. Next slide, please. Now here's a list of the contact information. So for anyone interested in finding a location near you, just call the 800 number. Let us know where you're, what city you're in, and we'll give you the closest location. Now, due to COVID, we are following CDC safety guidelines, meaning that if you come into the service center, we are only able to see 2 customers at a time. You must wear face covering, and some of them will take appointments. That way, if you don't want to wait, then with an appointment, it'll be a lot faster to provide service to you. I believe that was the last slide. So I guess we could see if there's any questions.
Great. Thank you so much, Lydia, for all that wonderful information. I had no idea that that information was out there. So this is great information for those of us, especially who might have family members who would benefit from this or work with the community in one way, shape, or form, and maybe haven't had to access these resources, but now that we know, might access them in the future. Thank you so much. So I'm going to open it up for any questions from the audience. We have Lydia here to answer any questions that you all might have. And if I don't see any questions from you, I do have a couple questions, Lydia. What inspires you to do this work?
Oh my God. So this is probably one of the jobs that I have really enjoyed the most. And the reason for that is unless you know someone that suffers severe hearing loss, then you really cannot understand, where this comes from. But when you provide this type of service for someone that hasn't used the phone for many years, and all of a sudden they're able to hear for the first time ever, their expression on the face, makes the whole world of a difference. And that's the reason why I've been doing this job for over 13 years. It's just the gratification that you get providing this type of service for people that really need it. It's something that really, really touches my heart.
Thank you so much. And thank you for the work that you do. So important, I think some of us, like I mentioned, who don't access this or don't need this, we don't think of those needs until we then do, whether it's a family member or neighbor or a community member. And so I'm grateful for people like you, to ensure that we're all covered, that the different resources that sometimes we might not think about, that they're provided through your service. So thank you for the work that
Yes.
you're doing and your organization is doing.
Yes, and I also wanted to share one more thing, unless we have questions coming up. But so one of the things is that people with hearing loss are able to hear, but they have a hard time understanding what the other person is saying, and that's just regular hearing loss. So what this telephones provide is the tone control, which manipulates the voice of the other person, making it easier for someone that has hearing loss to understand. And oftentimes, when we offer equipment for someone with hearing loss, the first thing they tell us is they don't work. I went and I bought a telephone. It was really loud, but it did not help me. So people with hearing loss, really what they need is they need clarity. And that's where the tone function comes in. And that's what these telephones offer. So I just wanted to put that out there in case anybody seeing us, and if they have relatives, and if they tried phones and didn't work, give us a try because you have nothing to lose.
That's great. Is there a phone number that I know they were on the flyers, but I
Yes,
want to make
yes,
sure to be able to capture that and put it on our screen so that people can take that down?
yes. For anyone that is interested, they could call 1-800-806-1191. In addition to the information that I just provided, we are also offering smartphone trainings. So for anyone that has either an Android or an iPhone, we do offer smartphone trainings, and it's just the basic stuff, but even just basic stuff, sometimes for someone that is not really tech savvy, it could be a wonderful thing. So we do have smartphone trainings for anyone with Android or an iPhone, and you could call the number on the screen also for more information on that. If we have customers or consumers that are homebound and they need help with their equipment to set it up or for training, we do offer home visits as well. But the first step would have to be to get into the program, complete the application, and get it signed, and then we could just kind of take it from there. But I also wanted to put that out there.
Okay. And so if I'm a family member or a friend of somebody that I feel would benefit from these resources and services, and maybe they can't just get on the phone and call, can I call for them and then help walk them through this process?
Absolutely, yes. We oftentimes we deal with a lot of either caregivers or family members. Sometimes it's even just a neighbor that's calling for their neighbor because they're not able to call on their own. But yes, definitely anybody could call in and get information or help with someone that's interested in a program or is already enrolled in the program.
Great. Well, I don't see any questions coming in from the audience. That means that you did a very good job of walking through all the process and we understand it clearly. So thank you so much. And I just want to also thank the Binational Health Week Coordinating Committee for our county and our, uh, different partners that we have, including you all, for the different resources provided for our community members throughout the month of October specifically. We had many events that our community attended. We still have a couple more coming up. I know we have one. Ricardo couldn't be on today, but I let him know I would make sure to cover it, where families can go. So thank you so much, Lydia, for covering information through California phones and the resources that are provided through your organization. And I look forward to our community accessing them, right? Especially if there's a need, and I want to, so thank you so much for being here. And now I want to let the community know about our uh, event coming up tomorrow. We have a trunk or treat event for our community, and you'll see it here. It is going to be in District 5, and it will be a collaboration with many agencies, many organizations. You can go there. It'll be 2 to 5. There'll be different events for all ages. There will be vaccines also provided through our public health department, through our county, and then also the Indian Health Center. I understand we'll be providing vaccines on site, resources, resource tables, activities, and just fun. Lowriders, our community will come out and bring their cars. So it'll be a fun event for the entire community. Please come out. It will be tomorrow from 2 to 5. We look forward to seeing you out there. Another event that also the Binational Health Week Committee is also participating in, and our county workers will be out there answering any questions too that you might have in person. Um, so with that, I do want to thank everybody for joining us today. Again, Corina Herrera Loera, Public Information Officer. Thank you, Lydia Santillan, for presenting to us from California Phones. And we look forward to continuing to connect. This is our last community forum for Binational Health Week for the month, but we will continue to have our community forums on a biweekly basis for the Public Health Department to continue to provide updates regarding any new announcements regarding COVID-19, vaccines. We're excited. We understand the 5 to 11-year-olds, we will soon be providing them in our county. And then the booster shots are already happening. So make sure to make your appointment if you haven't done so. So we'll continue to see you. Please take care, and we'll see you in a couple weeks at our next community forum for the Public Health Department. Otherwise, glad you enjoyed the Binational Health Week sections that we had for our community forums, and we look forward to continuing to provide more resources and services to our communities as needed. Thank you and have a great weekend. Bye.